Good afternoon to all of you and welcome to the post-lunch session of day one in the major hall, Hall A Convention Hall. In this session on pediatric ophthalmology, we have got along with me Dr. Sahasranamam, Chief Instructor. We have got three pediatric ophthalmologists, Dr. Rashmi Bhaskar from Chaitanya, Trivandrum, Dr. Chaitanya, our warrior from Chaitanya, Tiruvalla and Kottayam, and Dr. Vaishakhi Prasannan, pediatric ophthalmologist at Chaitanya, Kochi. And our star guest today is Dr. Shankar, who is Professor of Pediatrics and HOD of Medical Genetics at the SAT Hospital, Government Medical College, Trivandrum. And we are fortunate to have him as our guest speaker. Actually, he is the Scientific Committee Chairman of the Kerala chapter of Indian Academy of Pediatrics, and they are having their annual conference on the same days. And actually, their dates got postponed. But anyway, because of his commitment to me and also to his love of genetics being spread across, he has come all the way. So many thanks to, and I welcome you, Dr. Shankar, and thanks on behalf of the KSOS and on our behalf, hearty welcome to you. And though he is Professor of Pediatrics, he is this genetics, DM genetics, and the department of genetics makes him all pervasive. He can attend a conference of any medical specialties, irrespective of whether it is medicine or surgery. So the title is Pediatric Eyes Looking Beyond Vision. In 5 minutes, I'll just give a bird's eye view of what we are going to discuss in this session. Normally as ophthalmologists or for any doctors for that matter, when we look at, say, a child brought to us, talking about pediatric ophthalmology, a child brought to us with defective vision, we assess the visual acuity of the child. We assess the signs and symptoms, ask the parents, ask the child if the child is old enough. And we plan the necessary investigations which can be done in our clinic, in our room, and in our adjacent rooms in our clinic. And we treat accordingly. But there are certain situations, most of the cases which come to us can be either surgically or medically assessed and treated in our purview. But there are certain situations where you have to look beyond this. If we look at a child brought to us with a defective vision and the routine evaluation doesn't point to a diagnosis. It's not our routine refractive errors or not an uncomplicated strabismus or a congenital cataract which and the child being brought to us. So there is a defective vision in this child. There is a subtle posterior segment pathology. So we have to do more of electrophysiological studies to find out what this child is having. We see a child with defective vision. We see a subtle pallor, or we don't find anything at all, but there is a defective vision. So we need a medical neurology opinion, and we need a lot of imaging studies. A child brought to us with a congenital cataract or a retinal pathology or optic nerve pathology, we want to look at the genetics. So all these things will be covered in this 4 talks which ensue. And another thing is we have recognized CVI, cortical visual impairment, as a clinical entity, and lot of work has been done in the recent years. In the last 1 decade probably, a lot of work and improvements have happened in recognizing as well as treating. When we say treating, there are various modalities. So we know now at the present juncture, we know how to manage CVA in a better way than we used to in the previous years, but there is a long way to go. So that also we will discuss here. And if you look at the inherited genetic disorders, we have got a bunch of diseases in the eye, especially in the posterior segment, which fall in this group, and a lot of work is going on. And we have got in the last decade, we have been successful in coming out with an FDA-approved therapy for RP with RP65 mediated inherited retinal disease, Luxturna. And so this RP65 gene mediated disease, when we talk about it, it's not only, when we talk about RP, it's a small segment of RP. And also Leber's congenital amaurosis also can be RPE65 gene mediated. And genetics, like Shankar will tell you, there is an areas, the amount of genetics which we used to study earlier, no, it has, the advancement which has happened has leaps and bounds. So the genomic analysis, mapping of genes and the variants that contribute to, in our situation, inherited retinal disorders, stem cell therapy as regenerative treatment, social disorders, which we see experimental things in a lot of retinal pathologies, and neuroprotection and regeneration, like cell programming or cell reprogramming for that matter. Because recently I was reading that when we talk about cell reprogramming, we all know that Muller cells conventionally, when we used to study, we thought Muller cells have only a supportive function, nutritive function, homeostasis of the retina. But we have found that in cases of necessity, you can reprogram the Muller cells to become neural or photoreceptor components. So that is cell reprogramming. And in gene therapy, we have got like gene editing, genetic engineering tools, gene editing. Like we edit a video, if you have a mutation which produces a particular disease, we can edit that portion of the gene which has undergone mutation and replace that by a healthy gene, which will code for the right protein. So we have got the genetic engineering tools, and we have got pharmacogenomics. Patient care by tailoring the drug therapy to suit a particular individual's genetic profile. So lot of things are coming on. So thank you, and we will have the other speakers speaking to you on all this in the coming 40 minutes.